right, so let's get started. Good morning, everyone. Well, I guess it's technically afternoon. Thank you very much for joining us on our next installment of Workforce Wednesdays. This is part of a big series that we're offering local community businesses to talk about all the different things you might be struggling during the pandemic. This is about the middle of the sessions. There's still an opportunity to sign up for continuing sessions after this. We have Emily, who will be speaking today, but she'll also be doing a talk next week on overcoming the COVID-19 barriers for employee engagement. And then the week after that will be best practices of working from home and the healing process after COVID. And then we'll be wrapping up with advice from our community leaders, and that's going to feature a panel of people from SMI, from Southwire, from Yakio to talk about, and Tanner to talk about how we have handled the transition over the very challenging last 2 years. So I'm excited to kick this off today. You can also engage with any of those presentations by signing up on tanner.org. So let's get started. Our first speaker today is Emily Talley. She's the Vice President of HR for Tanner. She is responsible for all aspects of human resources management for Tanner's workforce of over 3,400 dedicated professionals, serving the needs of our patients and our communities. She brings almost 2 decades of HR experience and has served as a board member for HR and benefits professional organizations. She is a graduate of Carrollton High School. She completed her undergraduate degree at the College of William and Mary and her MBA at UWG. She lives in Carrollton with her husband, Alan. Tonya, the second presenter today, Tonya Fulks, she's the operations manager for Tanner Health System. She's responsible for coordinating and implementing all of the strategies around the Get Healthy, Live Well program. That program gives the opportunity to our community to lead healthier lifestyles. Tonya completed her undergraduate degree at Georgia Southern. She lives in Bremen with her husband and 2 kids. So I'm happy to introduce both of these ladies. I think you'll really be interested in the presentation they have today. So turning it over to y'all. Thank you.
Great, thank you very much, Kelly. So we will go ahead and get started. So just a quick overview of our agenda. We'll go into a little bit of who we are, though Kelly kind of has summarized that very well. Why we're talking about wellness, why Tanner was interested in wellness to begin with. An overview of, we really think of it as a journey towards wellness because it's never complete and never done. And then Tonya is going to jump in and hopefully give you some advice that you can use in terms of implementing wellness initiatives at your own organization. So building an annual wellness plan, some of the lessons that we've learned throughout the pandemic, and then we are both here to answer any questions that you might have. So most of you know, but we are your community hospital system. We have 5 hospitals serving more than 350,000 people. We have grown significantly since I grew up here. Now we have more than 400 physicians, 34 different specialties, and our employee population keeps growing as well. We actually recently surpassed 3,600 employees. And we now have over 30 different medical group practices throughout the region. So that's a little bit about who we are. And like most employers, wellness at varying times has been a focus, but where it really came sharply into focus for us was as we were looking at our health claims cost. So we were seeing, and this is the graph you're seeing in front of you, is our cost per covered employee increase year over year, which is not uncommon. Very rarely do health costs ever decrease. And that's true for us, even as a healthcare provider as well. But especially as we were going into the end of the 2000s, we were seeing double-digit increases, and we knew we had to do something differently. And there were kind of two different approaches. One would have been to, drastically cut our benefits. The other was to improve the overall health of our workforce. And being in healthcare and it being so critical to our mission, we decided to focus on that, improving the overall health and well-being of our team members. And that would help us to contain costs. We also thought it was important, being so tied to our mission, that we set an example for the community, and that we really walk the talk. Although that's sometimes very much easier said than done, as I'm sure you've seen working with your different healthcare providers. So when we look at our employee population, you would think working in healthcare that it would be really easy to get them to focus on wellness, but unfortunately, that's not always the case. So looking a little bit at our demographics, which we are very different from manufacturing, we are predominantly female, over 80%. Our average age is around 42. One of the challenges we have with any program from an HR perspective that we implement is that we have varied education levels. So we need to make sure that whatever we do is able to be understood by everybody, from those that have an 8th grade education to those that have an MD. So that can be a challenge as well. And we all are in the same boat in terms of, those comfort foods that we love are not necessarily the healthiest. And this was even before COVID, where, and you'll see when we get to our biometric results that we, like everyone else, have seen, an increase in weight and that, stress eating, what that can do. One of the things that's challenging for our workforce as well is that they are very much caregivers. That's all the sacrifices and things that they've been making over the past 18 months with COVID. We've seen that, but trying to get them to take care of themselves is very difficult and challenging. And even before COVID, they all had very busy lifestyles and competing priorities in their family lives and things. Like many different workplaces, we can't have long work hours. A lot of our employees work 12-hour shifts. They used to have short meal breaks. Unfortunately, during COVID, a lot of them are lucky to get a meal break and be able to break away. And a lot do have sedentary jobs. Probably the biggest challenge, though, is that it really is about engagement. It really is about behaviors and changing behaviors, which is not easy, because while those that work in healthcare know the things they should do to be healthy, in many areas, knowing and doing are two very different things. So as we were looking at how can we impact our overall employee wellness, something that we looked at was where can it make the most difference? So we looked at our health plan claims data and looked at how we could identify those areas that might be driving our costs. So we looked at our biometrics. What are things when we break down our cost based on biometric results? What are those risk factors that are contributing more so than others? And then really looking at conditions where we could have an impact. And for us, like many employers, that really is cardiovascular disease and diabetes. And then trying to make the business case in terms of, if we were to make improvements, where would we see cost? So our leading risk factors that we focused on biometrically were overweight, obesity, blood pressure, blood glucose, cholesterol, and then looking at health risk behaviors, particularly tobacco use is what we started out focusing on from the behavior standpoint as well. And then really what we've done lately, and we'll go over a little bit what our journey looked like, but lately it's really trying to incorporate a whole person approach to wellness. So looking beyond just those physical factors to mental health, to financial wellness, to socioeconomic factors that can be barriers to care. So what did our wellness journey look like? It started decades ago, actually. We've been doing health risk assessments, taking biometrics for our spouses and employees for many years. And that did help inform what programs we offered. But like a lot of employers, we offered programs and it seemed to sometimes be the same 20 people that came to every program. And they probably weren't the ones who really needed to increase their exercise and things. They were already on board. Back then as well, preventive healthcare under our benefit plans was very limited. We had just a very small budget that people could be reimbursed for different preventive care or wellness expenses. So in the 2000s, we started broadening that. We started broadening our focus on chronic condition management, partnering with local gyms to provide discounts to our employees, trying to encourage exercise. We really added robust preventive care benefits into our health plans. Back then in the 2000s, you may remember, was the time of the Biggest Loser challenges. So we tapped into that, engaging our leadership and community in weight loss challenges, and then rolled that out later to our employees as well. But we did start with leadership because that was an important component for us to set the tone for our employees. We added exercise facilities on our main campus and then spread those to our other campuses as well. So all during that time is that same increase in healthcare expense that you're seeing. So we're definitely focusing on wellness in lots of different areas, but we really weren't impacting our cost yet. What really started impacting our cost was when we started building in accountability into our programs and adding incentives. So we implemented a wellness credit program in 2010. We leveraged behavioral economics because employees are sometimes more motivated by avoiding bad things or risk aversion than necessarily doing something to get a reward. So what we did, because our premiums were increasing on our health plan, is we said, okay, normally you would have this much of an increase, but we're going to keep it at the current rate, but you have, until, for us, it was a July deadline to qualify for this wellness credit, or you will see that go away. So we tapped into that around 2011, and we kept building on that. So, at first we required that they meet 3 out of the 5 biometric targets that we'd set, and we did set them fairly easy at first. And then we spread that requirement to all 5 target areas, tried to make sure that we were adding lots of availability for our programming for people to take advantage of that, wanting them to empower them to really, realistically achieve those credits. And then we, like any program, we learned and tweaked as we went along, tried to streamline things as we could. We also added an extra mile credit for those that wanted to go above and beyond in a lot of different activities and ways to engage our employees that we could reward them for going forward. And then we're in the phase now where we're just gradually moving our targets, because we did start very easy at first on some of them, more towards the the recommendations from NIH and different agencies. So trying to get that gradually to be able to continue to keep that program fresh and moving forward. So we have had success. Like most employers, we really have seen our employee population's overall wellness hit pretty hard by COVID. So while we had seen when we first implemented that credit back, we launched it 2010, implemented 2011, we saw a very big dip in BMI. So we saw some great results, and then we're able to sustain that, but we are seeing that creep back up with COVID. With our cholesterol, we have seen an overall decrease. Our HDL levels have, which is your good cholesterol, have increased. That bad cholesterol, we've seen an overall decrease. And our tobacco use, which in addition to incorporating it into our wellness credit program, we also instituted a tobacco surcharge under our plan, which I know a lot of plans have done. And we've gotten our tobacco usage down significantly as well. But where accountability comes from an HR and wellness programming perspective is what has it done for our health cost? So we were seeing an average annual trend, right before we implemented the wellness credit, again, double digits, 11.5%. And then since we've implemented that wellness credit, and really, this is not all specifically tied to wellness. We've done a lot. We're very active in terms of managing our health plans through plan design changes and different things. But overall, we have seen a significantly lower trend since we've implemented that wellness credit. So about 1.3%. Like many employers, we did see an uptick with COVID as well too, but I think I am grateful that we did have this focus on wellness and this focus on chronic condition management, because I think it positioned us to be in a better spot than we would have been as our employees take care of others with COVID and battle COVID themselves. So, Tonya, I will pass it over to you now.
All right, thank you, Emily. And give me just a moment to share my screen. Sorry, give me just a second. Here we go. Thanks everyone again for joining us. So this slide is what we do, and this is really also what we did to lead us to through the journey that Emily just spoke about. And that includes consulting and planning, implementing our employee wellness portal. When we first started this, we started it all with our the wellness programs with our health assessments and biometric screenings. It's from the data and the results from those screenings and assessments that really builds the wellness program, specifically around our workforce, our Tanner team members, and what we've delivered out into the community with our community partners in building the wellness programs tailored to the health needs of that employee population. And those programs include self-management classes, health education, a lot of different speaking engagements, including lunch and learns, well breaks, seminars, and a multitude of webinars. Especially during the pandemic, we took a lot of our programs online to be able to work with Tanner team members and community members, both where they were located. So there were many that were in a hybrid position, some working remote, some still working on site, and that continues to be the case through the pandemic. So that's really one of our learnings in developing those programs and making them fit to the employee population and where we can best serve them. We also provide the customized health coaching, both one-on-one and in group settings. And then, as Emily mentioned, it was really important through this journey and in the beginning and continuing all the way through to have top leadership involvement and engagement in these wellness programs. Another thing that we looked at and are continuing to do on site here at Tanner is our cafeteria menu and vending machines, and really offering healthy choices for the employees and team members, and looking at the vending machines and working with our vending contractors on offering healthy options within those vending machines too. And then also offering educational displays. And I know that I've worked with several of you that are on the call today with educational displays and health fairs on site at your organizations as well. It provides a lot of engagement with the workforce to have those education opportunities on site, and then also having our team members on site to help with that as well. So that would include several outreach coordinators, clinicians, dietitians, and all. And then also our chronic disease and nutrition education clinic. So we have that here on site at our Get Healthy Live Well offices on the Tanner campus in Carrollton. And they also rotate out of at Villa Rica at our Health Source facilities and Bremen. And that team includes a registered dietitian and 2 registered nurses and one including a certified diabetes educator. So that's the pieces that we put together to build our wellness program. And then as we've developed all of that, being able to take it out into the community as well and help our community partners implement programs similar to help with their wellness programs within their organizations as well. through the course of all this, we've developed the infrastructure to engage the businesses in our community. And you all have met Kelly on the call here. So Kelly's our Vice President, Marketing Strategy and Planning. I'm the operations manager for the department. And then below that is a list of all of our staff members, their credentials. But note as well that we also have several additional certified evidence-based class instructors that go out into the community and provide a lot of the different programs I'll share with you that help you develop your wellness program and implement them there on site for your workforce. So again, as far as developing the annual wellness plan, we spoke about the health assessments and screenings, analyzing those results, and then developing a plan of action. Building those awareness building activities. We implemented several of those and continue to do so based on the results of our annual health assessments here at Tanner. And I'll go into a little more detail about that in an upcoming slide. But it's really tailoring the programs each year and developing that calendar based on the results of where your aggregate reporting of the health assessments and biometric screenings, and the keeping the employees engaged in those programs, but also behavior change, educational opportunities. And I'll speak in a few moments about the different classes, support groups, and worksite campaigns that you could implement there on site to help your team members, and then supportive environment initiatives. So one of the biggest things is making the easy choice to be the healthiest choice. And, you know, we've been really involved in implementing bike racks and walking paths. One thing that we're looking at now within Tanner at our different facilities are having quiet rooms to where employees can just take a breath, just get away from all of the noise for just a few minutes to breathe and to have just a few moments of meditation or just quiet time to reflect and take a moment aside. And I think that could be the case just outside of healthcare, but in a number of different industries because of so much noise and feedback coming from all around us. Quite often we need some quiet space, and that helps with the well-being of our employees. And then also help supporting policies such as smoke-free policies. We've worked with a number of organizations and partners in the communities surrounding on smoke-free policies and implementing those, whether it be faith-based or school systems, city municipalities. So a lot of organizations we've worked with on implementing those smoke-free policies as well. And then I mentioned the wellness coaching, both one-on-one approach on site. And then most recently through the pandemic, we've tailored that program to be able to meet with employees through Microsoft Teams, Zoom, phone, whatever we can do to reach them and help. So really thinking about that, especially for those of you who have hybrid workforces, this really plays a part in that as well. And then developing program engagement calendars. I mentioned that a few minutes ago. That's building the activities, the trackers, the work site campaigns. And really, we build ours out a year in advance, and then we can tailor it by the quarter, by the month, or just whatever needs might come up. We can add different things, especially when we get feedback from our team members on what they need, and we see some trends in the wellness coaching, when we see trends in that, we can kind of see some triggers that are coming, then that's when we just really tailor in and build some new programs for them to address any health needs that they might have coming up. And then developing the incentive strategy, as Emily mentioned. That's really important to help keep the employees engaged in any wellness program. And then throughout all of this, you just maintain, report, look at the findings, and then adjust as needed. So this a la carte menu of services to help meet your goals, these are the programs that we've implemented both on site at Tanner, within the community at different locations, whether that be different libraries, senior centers, schools, again, the churches, a lot of our business and industry partners. So we can take these programs on site to your organization. These are programs we offer here on site at our offices, just throughout the community. And those include the self-management classes. Many of you may already be familiar. I think a couple of you on the call have participated in several of these classes with us. But that's the diabetes prevention program. That's a CDC certified program, nationally recognized. It's a 12-month program that helps participants fight the risk factors for developing type 2 diabetes. We have gestational diabetes, folks who have gestational diabetes in that group, and then as well as those who have been diagnosed with prediabetes. Great results from that program. And then our next one is the Living Well workshop. This is a 6-week program that helps participants manage any chronic disease, and that could include arthritis, cancer, depression, heart disease, hypertension, just a long list. So if you have any employees, I'm sure you do, that are battling any sort of these chronic diseases, this program really talks about healthy lifestyle, nutrition, exercise, managing day-to-day living with chronic disease. And it meets 2 hours once a week for 6 weeks. And then the one right below that's a Living Well with diabetes. And it's a very similar program to the Living Well workshop, same sort of setup, 2 hours a week, once a week for 6 weeks. But it's designed specifically for type 2 diabetes. And then I'm sure you're familiar as well with the Fresh Start Tobacco Cessation Program. That includes any form of tobacco. It also now includes vaping. It's a 4-week class that meets 1 hour a week, and it helps participants to prepare to quit and be ready to quit. We've seen a lot of success with that program as well. Other programs that we've implemented within Tanner and then within the community and our community partners as well as the Carb Counting and Diabetes 101. Both of those classes we developed internally. Our dietitian, our certified diabetes educator, and nurse, they all developed those 2 programs. We started those in person, and through the pandemic, those were the first 2 that moved online. We have a lot of engagement, a lot of interest in those programs. The Carb Counting program was initially developed specifically for those battling diabetes. But we had so much interest from those who were interested in losing weight as well, who may not necessarily have a diagnosis of diabetes. They had a specific interest in that carb counting class. So we have moved both of those classes online. We offer those monthly. And then also men's and women's health courses and programs. Your Health and Sugar, that's just another program and class that we offer, as well as food label reading and Tai Chi for health. Some other things that we offer and that we've implemented on site here have been educational displays to be used at employee health fairs, other employee events. Have a couple of partners in the community who they have well seminars for all of their employees quarterly. And so we take these on site. We've also developed some webinars to include these educational displays as well. So just really tailoring it to the times and what we're going through with the pandemic, and again, being able to reach as many as we can through these programs to help with the wellness and the well-being of our community. And then providing just different handouts and information, visual learning aids, for any of the needs that we might have in the community. The others would be the blood pressure, cholesterol, lots of different displays. One that's really of interest are the pig lungs. So whenever we take those pig lungs out for health fairs, they get a lot of attention because we have side-by-side pig lungs, one that's never had nicotine, exposed to nicotine, and one that has. And the difference is just stunning, and it really draws a lot of attention. And so those who, I know several of you on the call have seen those and have participated in health fairs where those have been, we've had those on site, and just it really engages the employees. And so back to the process, if you're looking at developing a wellness program within your organization or add to it, Some of our recommendations would be to really think about completing the organizational assessment. Where do you stand now? Go ahead and just walk the environment. Where do you see that there could be opportunities, whether it's in the vending machines or it's in the cafeteria if you have one of those on site? What are you offering at lunch meetings and things like that? And then definitely we would recommend the health assessments and biometric screenings next, so that you've got a pulse point of a starting point of where your workforce is currently and their health needs. And then developing that wellness program planning, developing it based on the results of the health assessments and screenings, and the organizational environment. That organizational assessment is really important. And then establishing some sort of employee engagement tool. That's really important, especially we have found that to be of tremendous help, especially during the pandemic. That was one of our learnings. We could really see the engagement as it trended up and as it trended down through the portal. Those that had their fit trackers, we could see that there might be some I guess, not as much engagement in exercising and walking, running. And we could see some of that kind of take a decline within the portal. So we knew that it was time to ramp up the challenges and have some different employee challenges to kind of offset that and get people re-engaged. So just be thinking about that. We do recommend having some sort of engagement tool that you can use to pull the employees in and to communicate all the different things that you have going within the wellness program. And then, as I mentioned before, just continue to analyze, look at the different reports that you get from the screenings, the assessments, feedback from your employees, and then readjust as needed and as their goals change for their wellness. So. And then I did want to include this information on this new program that we offered. We started this right in the middle of the pandemic, our Foodist Medicine program. Our first class was July 18th of 2020. And this was something that obviously the pandemic really exacerbated and brought to light the food insecurity and food deserts within our community. And this program has really touched so many people over the course of the last year. And as I mentioned, it's a pilot program. We just finished up year one, but it's our Foodist Medicine Healthy Food Pharmacy approach to combat high rates of diabetes and hypertension in the community. And we are looking at other disease states to incorporate into this program and implement over the course of the next year. But it provides food insecure residents with diabetes and or hypertension currently with free access to healthy food, education and health coaching to improve their health status. We have had 84 participants serve in this last year. That was from July until June of 2021. And we've provided over 18,000 pounds of healthy fresh fruits, vegetables, dairy, meat, and shelf-stable items. And to give you kind of just a quick overview of what that program looks like, we initially started it as a one-year program for each of the classes. Because of the pandemic and recognizing social distancing, we had to limit each class to 15 participants and currently still do that. So we would have maybe 5 classes going at a time. And we found that the retention over a year-long programs that was a big challenge for us. So here recently, within the last several months, we've tailored that down to have the diabetes program be 12 weeks in length. They meet weekly, and the hypertension is 6 weeks. And we have those ongoing, and we post those new classes on Tanner.org. But each class, they come in once a week, and they'll have 30 to 45 minutes of in-class education. And then they walk across the hall, and in our teaching kitchen, they receive a cooking demo of at least 2 recipes. And they receive those recipes following the cooking demo and the taste testing. And then they receive a food box that is filled with all of the ingredients that we used in the recipe, as well as other fresh, healthy fruits and vegetables, shelf-stable items, anywhere from 10 to 15 pounds in that box that they can take home to their family and use for that following week until they come back the next week and visit us, and have the classes again and receive another food box. So the results are right there for our first year pilot program, and you can see the great results we've had, decreasing A1C rates, BMI, and systolic and diastolic blood pressure rate readings. So it's really, it's a great program. We continue to tailor it to meet the needs, and we're looking at offering it as well to those who are not food insecure. So just keep that in mind. I was hoping that perhaps some of you might know, whether it's employees within your own workforce, in your own organizations, any of your family members or folks you know in the community, just keep that as a resource in the back of your mind as we continue through this pandemic, because the food insecurity rates have really increased that we've seen. So I definitely wanted to include that. And so that's it. So any questions at this time? And I'm going to stop.
There aren't any questions in the chat. But I appreciate you ladies putting this together. I think that we are all struggling with how to keep exercise and fitness and health and at the top of our minds right now, with as stressful as it can be at work and at home dealing with the pandemic. If there aren't any questions, you can always email, reply back to Hannah's email if you have a question that we haven't covered here, or if one of the presenters can answer it, we'll certainly do that. And just remember that we have several classes coming up. Miss Emily will be speaking again next week, but you can register for those online also. So if there aren't any other questions, then we can give you back a few minutes on your calendar, which everybody can use. Thank you all so much for being here. We really appreciate it and look forward to learning more next week.
Great. Thanks, everyone.
Thank you.
Thank you.